What is the difference between beneficial graft-versus-host disease and harmful graft-versus-host disease?
So this is a really contentious topic. So graft-versus-host disease is where the graft, which is the cells you get from the donor, mount an attack on the host, which is the patient with myeloma. So that is graft-versus-host disease. So the assumption is that if your donor's immune cells can recognize the recipient or the host as a different person and attack them, they can also attack the myeloma, which is part of the recipient or the host. So graft versus host correlates with what we call graft versus myeloma effect. So it is best to have no graft versus host disease and have a graft versus myeloma effect. Now that does happen. There are people who get a transplant and they don't have any detectable graft versus host disease, and they basically have cleared their myeloma successfully. That is the luckiest option. In some cases, you get what we call a acute graft versus host disease, which is the type of graft versus host disease that happens right after transplant. And that is usually associated with some rash, diarrhea, nausea, vomiting, liver abnormalities, etc. And that comes and goes, and the patient still feels good, and the anti-myeloma effect continues. But very severe acute graft versus host disease, which is not controlled by medication, can be fatal, and that would not be a good thing to have under any circumstances. So we would wish for a minor amount of graft versus host disease that also eliminates the myeloma as the good graft versus host disease. Whereas if it's a long-lasting graft versus host disease, it's more called a chronic graft versus host disease. And the data in myeloma allotransplants is that chronic graft versus host disease at a limited level does have some protection against myeloma relapsing, whereas the acute bad graft versus host disease generally does not correlate with a long sustained immune effect. So this is, again, a controversial topic in that, you could have no graft versus host disease and an immune effect, a lot of graft versus host disease and an immune effect, but then you'd really wish you didn't have the transplant at all because the graft versus host disease is just as bad. So, the golden balance is to keep the patient with just enough graft versus host disease or just enough graft versus myeloma effect and not too immune suppressed so that the myeloma just stays away.
Is that luck of the draw, or are there therapies you can give?
So it's a lot of it we would say it's a little bit luck of the draw. It is a little bit dependent on the immune sensitivity of the myeloma to the immune effect from the donor cells. But we can actually ramp up or down the immune effect by adding more immune cells. We call it donor lymphocyte infusions. I have, for example, patients who got donor lymphocytes for their relapse 15 years ago, got some new fresh immune cells from the donor, and put them in, and the patient has never looked back in terms of getting myeloma again. So for that person, it would be luck of the draw because we actually did not even know much about myeloma in those days. Now, the other scenario is that you can dial down the immune suppression and wish for a little bit more graft versus host disease. And sometimes that is, there is a little bit of an art to doing that.